and Indian Academy of Health Psychology, Professor N.K. Saxena. He will be joining us shortly. He will be with us. Dr. Professor Zaidi from Amity University, from Amity, Jaipur, will be here. So I'm inviting Professor Anand Kumar sir to introduce Zaidi sir, Saxena sir, and invite the speaker for today's lecture. Anand sir, please.
Thank you, Dr. Rakesh Jain ji, and welcome Professor Zaidi Saab and Professor N.K. Saxena Saab to this program of Indian Academy of Health Psychology e-webinar. This is 17th e-webinar and series of lecture, and we are feeling blessed that we are having with us two stalwarts, Professor N.K. Saxena and Professor Zaidi Saab. I would like to introduce Professor Zaidi. Professor Zaidi is head of the clinical psychology and director AIBAS at Amity University, Lucknow, and he has 42 years of teaching and clinical practice experience, and he was trained in CIP Ranchi, Rimhans, Bangalore, and Mental Health Department of Glasgow, UK. He has worked as faculty in CIP Ranchi. He was Deputy Director at Rehabilitation Center in Ministry of Labour. He was Executive Director of NAB Bombay, and he was Consultant Clinical Psychologist at Indian Air Force. He is visiting faculty of CIP, Mumbai University, Tata Institute of Social Sciences, and many other institutions. He has been appointed as member Zonal Coordinator Committee of Rehabilitation Council of India for UP and Jharkhand, that is the central region. He has many research publications and book chapters in his credit, and he is the recipient of National Award of Empowerment of Persons with Disabilities, and he was honored by President Dr. Abdul Kalam. He was also recipient of C.J. Kang Oration Award for his contribution in the promotion of clinical psychology in India. Today, he will be talking about the psychological perspective of trauma in special reference to children. So, I invite Professor Zaidi to bless us with his presentation.
Thank you very much, sir. Thank you very much, Professor Anand Prakash. Today is a very, very great day for in my entire career, I would say, because the first teacher of psychology is here, and he is here to bless me. Particularly, he promised yesterday that I would be there in your program. I know that he is very, very active. He attends all the programs. But for me, it is a very special occasion. Professor N.K. Saxena, I am his student. And that is why I am saying that my introduction, which Professor Anand Prakash has given, is nothing but that I am a student of Professor N.K. Saxena. God has given me two very stalwart teachers. One is Professor N.K. Saxena, who gave me the first lesson and explain and clarify that why psychology start by P. अदरवाइज अगर ये मामला क्लियर नहीं होता तो शायद मामला आगे नहीं बढ़ता था कि ये वाई व्हाट इज द सब्जेक्ट वेयर द वेरी स्पेलिंग ऑफ द सब्जेक्ट इज seems to be logical, that psychology, everybody saying psychology should start by S, why it is starting by P. So it was Professor N.K. Saxena who explained in the very first lecture. And the second great teacher who appreciated my contribution, whatever little contribution I could do, is Dr. APJ Abdul Kalam. So that way I'm bracketed by two stalwart, two great teachers, two great human beings. And with his blessings, I'm going to speak on a subject which is of very important nature. Dr. Prakash, should I continue with this, or you are going to introduce Dr. N.K. Saxena also before I start my formal
Oh,
presentation?
yes, you can start. You can go ahead.
Okay.
Yeah.
Well, the topic which you have selected is a psychological perspective of trauma with a special focus on children. Before I start showing my PPT, I'll just see that why I have taken this topic and what is the relevance of this topic. I think nobody can else appreciate that what is the trauma in the practical sense than we all. Last 4 months' time, with sudden change in the environment, sudden change in the health conditions, sudden change in the threat disease, we all are passing through extreme psychological stress. God has blessed us by saving us from physical illness, from COVID. Still, out of total population, our percentage of persons succumb to the injury or having the active symptoms is not more than 4 to 5%. Though it is increasing, but still it is 4 to 5% of entire population. But 100% people are scared of it without having even a single symptom of COVID. But we all are scared of it. We are all shaken out. I'm not going to speak on the COVID because you have been hearing COVID. I'm not going to speak about the COVID. What I want you to understand, appreciate what we really mean by trauma. And that is why, and this is not the new thing, since immemorial, people have been facing different type of shocks, physical shocks, climatic shocks, but these shocks can make the person wounded, that can make a person died, but that is for one time or another, for some time. But if it is the impact of this calamities, the impact of this sudden change, the impact of this unexpected events, if it is continuing, then the person becomes traumatized. And being a traumatized is much more serious things, and there lies our intervention, there lies our contribution in this health psychology. डॉक्टर साहब तो पट्टी बांधेंगे, डॉक्टर साहब तो प्लास्टर कर देंगे, डॉक्टर साहब तो आपको 4 दिन 5 दिन 10 दिन he will keep in your hospital, he will give all the best possible treatments and all this, and he will say namaste after 10 days. But the confidence which you have lost during that event would and can only be minimized with psychological support. So with this background, I thought that I should speak on trauma and with a special reference to the children because they are our future. There are future civilizations. So if the future civilization, if the seed of the future civilization is growing under traumatized condition, then it is our responsibility to address the need and address the challenges and to see that our children are comparatively relieved from the impact of trauma. So with this, I'll request for my first slide. Next slide, please. Can I have slightly zooming of this? Will it be possible? Jain sir? Jain sir?
Trying, sir.
Yeah.
Trying, sir. Trying, sir.
I won't mind if you don't show my full face, but I would like to see my slides.
Sir, can we manage this existing PowerPoint
Okay,
as it
okay,
is?
okay. I'll see. I'll try. Okay,
Please. I'm
okay.
sharing once again.
Yes.
I'm sharing once again the same format because it is taking some time. So we have to change this platform.
I can do one thing, that I can minimize this screen and open my PPT over here, but that will not be seen by others. That could be the issue.
There is the setting. This software is like this.
Okay.
Just let me.
Yes, now it's fine. Well, my dear viewers, I would say one thing, that during my slides, while you will see my slides, you will not find any reference, you will not find any theory, you will not find any very big terminology, because what I try to explain, it is on a very simple way, so that my juniors, my seniors are very well aware of all these things. My juniors can understand what I want to say beyond technical terminology and definitions and the references. Well, how to define trauma? As simple as this. Traumatic event is any event or events which overwhelm our core capacity to cope. It makes her absolutely emotionally shaken to the extent that our capacity to cope with the stress reduces. It results in an experience of personal threat to our safety and our integrity of our identity. The worst part of it is that it is not only threat to our physical fitness. Yes, it is there, but much more than a serious issue is that it is a serious threat to our integrity and identity, what we are, how we are now, where we'll stand. Total dislocation of this disease has totally dislocated the whole economy, totally dislocated the whole working culture, totally dislocated the platform where we're working. So, and we have lost the identity. Who am I? I was something like that when I was working in Mumbai, but here what I am. So next please. Trauma can be classified in two simple ways. One is the complex trauma and another is the acute trauma. Complex trauma can be, next please. Complex trauma can be further defined as multiple or chronic trauma, multiple series of events, multiple drawbacks, multiple setbacks, particularly multiple setbacks during the developmental stages, adversely interpersonal victimizations. That is why I'm telling that the children are more victim of this, more subject to this, because during the process of development, during the process of formating age, if he is passing through series of today there was COVID, yesterday there was a flood, before that there was earthquake. Every time he and his family is trying to rebuild, and every time he's been destroyed. Every time he's trying to rebuild, every time he has been shattered once again. So he has developed himself during the process of trauma. I have worked in Srinagar also. I have worked in different parts. I have seen this phenomena happening in Srinagar. The children who are now grown up, 20 years, 25 years, have never seen a street without CRP and without BSF. They do not know that there could be an electrical pole under which no CRP person is standing with the rifle stretched. So for him, you just visualize the personality development, the development process of that person, who would never know that at which point of time there would be a lockdown, and which point of time there would be school block, school discontinuation, there would be some bombing, there would be some explosion, something like that. So it is a development process, the series of events which is in development process. Number next, physical, sexual or emotional abuse and neglect. नहीं सर यही कंटिन्यू करें, सर यही कंटिन्यू करें, जैन सर, yes. Physical, sexual and emotional abuse and neglect. It was not one event when somebody tried to misbehave and somebody tried to sexually assaulted. It is continuous process. Every day the child or the girl of teenage is getting abused. Domestic and community violence. It has become the rule. Domestic life, domestic means when you are living in the family. It is. I have seen a case when I was working in different places. A girl reported to me that she was otherwise a good student. She reported to me that, sir, our life starts at night, 3:30 midnight, when my father, after beating my mother and we all under the influence of alcohol, when he totally knocked down, then we get up, I start working in the school, complete my homework, take food and prepare for the next day. So this is domestic violence. Domestic means when he is inside, it means that he is living in the tank of violence. And community violence. It is not that it is only one time occasion that something has some spark has taken place. The entire mistrust. I will be talking about all these things. It is going on. Next, please. Please. And what is acute trauma? Acute trauma is reverse to that. It is an acute, short-lived, sudden happened. Example is serious accident. Community violence, suddenly something has happened, otherwise we were living very comfortably, suddenly something has sparked, and there was some 1 or 2 days, some stress, some tension, and it was reduced, minimized, and again people start meeting, again फिर वही India हो गया. For a day or two, we were living perhaps in a very, very different place, but after 2-3 days, we became again the same place. And natural disasters, earthquake, flood. During my stay in Mumbai, I have seen earthquake, I have seen flood twice, but it was for few days. It was recovered. Mumbaikars are known for recovering for all these stress situations. And a sudden or violent loss of loved one, sudden cardiac failure, or somebody has killed him, murder ho gaya, unexpected. And physical or sexual assault, being raped, practically raped. So these are the typical example of acute trauma. Next, please. Next, please. During the acute event, children go through a variety of experiences, starting from feeling, thoughts, and physical reactions. Simply, feeling follows action. Simple, basic psychology. Simple feeling follows thought, thought follows action. So the children pass through this that are frightening in and of themselves and contributing to a sense of being overwhelmed. And these experiences are not just a change of mood. It is not just an irritation, mild irritation. It is not just a refusal of one-time food. It is serious and it is overwhelmed the entire child, his childhood rather, I would say, not childhood. Next, please. Next. Chronic trauma refers to the example of multiple traumatic events. I've already discussed. Complex, it is complex because it is a multiple series. In a series, one is going, I have met with a family, handle one family in Patna when he was very senior police officer. His son-in-law was murdered. His daughter was coming and they were living in somewhere else. His daughter was coming to attend the funeral and the flight crashed in front of them only because they were living near Patna airport. And he was seeing that he was waiting that the flight is coming now. I should go and receive daughter. But suddenly he saw a ball of fire, and it was happened to be the flight aircraft in which his own daughter was flying. So series of, and there could be many, and it's not the film story but it happens. Sometimes it happens. There are a number of experiences. It happens, and the effect of chronic trauma are often cumulative to each event services to the remind the child of prior trauma and reinforce the negative feelings. And this is the worst part of whole story, that this series of trauma is not allowing child to come out of it, and it is keep on reminding. The first trauma is reminding the previous trauma is reminding the prior trauma, and it is all the time reinforcing his negative thoughts and his mistrust on the situation, and that is making him still worse his condition. Next, please. Next. Now, a statistic on impact of trauma. I have put a very big question mark. Usually, we in scientific presentation, we quote statistics. But I personally feel no statistics on trauma could be up to date. No statistics on trauma could be reliable. This could only be just probabilities. How it could be a reliable statistics? I met with an accident. A person is passing through. He saw a person lying on the pool of blood. He is neither victim nor his relative, but is traumatized. He is not reporting to anybody. He is not going and complaining anybody that somebody has done this thing or that thing. But he has seen a person dying on the road, and that very sight is, and he was just passerby. The very sight has traumatized him, and he has become the victim of trauma of that situation. So I have put a question mark that it is not, at least to me, what I understand trauma, to me it is not possible to count that how many persons are traumatized. However, WHO has given some rough estimate that the women are more subjected to trauma than the male. They are reporting more side effects, prolonged traumatic experiences than the male. 40 to 60 ratio, but I always put my finger across whenever I talk about trauma. You are going through this COVID. Hardly, as I told you in the beginning itself, 100% population are scared, and children are asking, who is living, my own grandson, 4 years, he has not been allowed to from his house. He is seeing his park where he used to play, where he used to swing and all these things. He has started asking कि lockup कब खुलेगा, दादू lockup कब खुलेगा, not lockdown. He is considering himself under house arrest. Now children are realizing that what is house arrest. TV and mobile has developed, has made them understand all these things. हमारा ये house arrest कब खुलेगा, हमारा lockup कब खुलेगा. And every evening at the same time he stand on the balcony with tearful eyes. I take him as equally seriously traumatized child. So, and he is not counted in the trauma. Nobody has reported. He has not occupied any bed. On the bed basis also, there is a statistic that about 35% bed of the general hospital is occupied with the trauma patients. So that could be a rough estimate. How many person has died in any accident? How many person has wounded? All this could be a rough estimate of trauma, but cannot be any precise, neither incidence nor prevalence figure of the trauma. So I have put this question up to you to gauge what is the size of this problem. Next, please. Next, please. Now, what, after having this, after understanding, after discussing this thing, let us discuss what were this trauma, particularly during the development process, are influencing our children, are likely to influence our children. Well, I have distributed these influences in 7 broader area, 7 domain in which these children are exposed and the trauma are feeling disturbed. Though the slide is, I'm still trying to read. And the first classification I would say is the attachment. His attachment with others, his attachment with the people around, his emotionally attachment, his physical attachment. And under this understanding about the reliability and can जैन साहब थोड़ा सा और इसको बढ़ा सकेंगे और थोड़ा मेरी फोटो हटा के अगर स्लाइड लग जाए तो ज्यादा अच्छा रहेगा आई वुड बी रादर मोर हैप्पी आर्य सर स्लाइड से रीसेट कर रहे हैं Okay, I think it is comparatively better. So one of the important negative impact with the child is feeling is uncertainty about the reliability and predictability of the word. उसका पूरे दुनिया से विश्वास कि it is the entire world is child start feeling that it is everything is absolutely unpredictable, unreliable. And this is, if it is coming from the very beginning, it is going to have very adverse impact. Problem with boundaries. He is not very sure where is Lakshman Rekha. Anything can happen. कोई कुछ भी कर सकता है. Particularly if he is saying that he is being raped or he has been assaulted, he has been sexually abused by someone to whom he cannot even think of. So where is the boundary of our deterioration? So for him there is absolutely, it is boundary is unperceptible boundary, and to what extent she is safe and to which point she is safe, to which point she is unsafe, become very difficult questions to answer, and this leads a very serious impact on his social interaction, social attachment with others. Disturb and suspiciousness, distrust and suspiciousness. She starts or he starts, child starts suspecting everybody and start feeling distrust. Nobody is trustworthy. In fact, this is not the true. Still, there are so many persons to whom a child can trust. But a traumatized child, if you ask traumatized child, he stop even trusting his own parents, own father. That no, even father cannot be trustworthy because he had once touched me on a very awkward places, bad touch. He has shown some bad touch also. So so this is generalized behavior, generalization of this fear, and that starts giving the seed of paranoia and seed of some mistrust and uh, social isolation. He isolates himself socially totally. He's scared of interacting. He is a phobic, social phobic. Sir, slide. Jansa slide. So social isolation is again problem, again thing which the child start getting from the very beginning itself. Hmm. Yes, sir. Interpersonal difficulties, very serious difficulty in interpersonal relations. Difficulty accommodating with others people emotion, again very serious things. The person is not at all, the child is not at all bothered about your emotions, other emotions, because you never bothered about her emotions. You never bothered about her feelings, his feelings. So why should he follow about it? So total detachment of emotional detachment, total lack of accommodations, total lack of adaptability with emotional conditions. A difficulty with perspective, positive gain, total loss of hope that he is not going to gain anything out of it. Life is nothing, there is no positive thing is left out is stored in his life. And that makes him very negative, very pessimistic, and very isolated. Difficulty in listing others people as friend. Similar thing that if you ask who is your friend, nobody. No, I am your friend. No, not at all. You're not my friend. So when the child start this level of detachment, then you can see that what would be his personality development. Next, please. Physiological changes. It is not only that it is trauma is only causing impact in his psychology, psyche. It is also changing in his physiologies, particularly a lot of psychosomatic issues. Sensory motor development problem. The child, the number of studies reported that the traumatic child, the child who has been in the early age, is showing these type of problems. Hypersensitivity to the physical contact, analgesic, problem with coordination, balance, body tone, difficulty in locating the skin contact. We have done, Professor N.K. Saxena only taught us 2-point threshold in the very beginning itself, where we know that to have and sense to have an stimuli, it is not that there should be a stimuli, it should be strong enough, it should be uh, big enough to be affected. So the locations of where is the skin, where it's been touch, contact, touch, everything is totally disturbed. Somatization. आज पैर में दर्द हो रहा है, सर में दर्द हो रहा है, पेट में दर्द हो रहा है, all the anxiety, all the fears, all the bad experiences are converting into somatic symptoms. Increase medical problems across the wide span. Pelvic pain is reported among children who has been sexually assaulted, even when nothing was there. Phantom pain. We all know that what is phantom pain. Continuous chronic headache, chronic ache and pain. So these things are reported with children. Skin problem, rashes, allergic responses, Autoimmune disorders, the children are not developing the immunizations. He is not responding to any things which is helping, any diet which is helping him to become immune to physical disease. So he's getting very frequent infections, very frequent problems because of a decreased autoimmune system. And pseudo-seizures. Pseudo-seizures is, we all can discuss circumstances in which a person may get pseudo-seizures. Pseudo-seizures means that when there is no obvious epileptic seizures, but the person is showing the features like seizures, pseudo-seizures. Next, please. The third domain which is affected is the affect regulation, difficulty with emotional self-regulations. Difficulty describing feeling and internal experience. The child cannot explain. There is a term for this. That the child cannot explain that whether he is feeling good or bad, whether he is feeling happy or sad. It is not anhedonia. There is a difference between anhedonia and this condition. Anhedonia is the condition when the person cannot enjoy any type of feelings. Here he is passing through the feelings, but he is unable to explain what type of feeling he is getting, whether he is happy or he is sad. Problem knowing and describing internal states, how he is feeling, whether I'm feeling well-being from within, I'm happy from within, or I'm not happy from within. Just like a statue, emotion-wise, a statue never reports you. So whether the statue is a stone statue is feeling good or bad from within, whether he's feeling heat standing on the crossroad or wet feeling when he's standing on the rain, he is not getting any type of feelings. And difficulty communicating wishes and desires. If you ask that what are your wishes and desires, I have examined in such case when in mental state examination we ask three wishes test. What is your first wishes? What is your second wish? What is your third wish? And the child is responding no wish at all. He is not replying at all. Not because he is a non-cooperative, he is angry. He doesn't know what does he want. क्योंकि अब कुछ बचा ही नहीं चाहने के लिए. He has passed through in such a traumatic condition that he is losing any desire to have any wish. Next, क्योंकि जो चाहते हैं वो होता नहीं, जो कहा जाता है वो सारे लोग हैं नहीं. So all these conditions, if it is experienced in formating stage in the development process, I have mentioned this thing that chronic or complex trauma experienced by adults also. But that could not be that difficult. Income tax, this problem, that problem, this issue, that issue. The adult is there, he is well matured, his personality has been, his resilience has been developed to great extent. He can cope up with the situation. At a time, घर में 4-5 आदमी बीमार पड़ते हैं, financial issues भी होते हैं, and he is stressing, he is coping with this, but not at the stage of formative stage. So difficulty communicating wishes and desires. Next, उसको भूख लगी बता ही नहीं पा रही. What does she want? Whether he wants food or whether he is thirsty, he needs water. Dissociation, distinct alteration in a state of consciousness, confused state. Twilight stage. He's all the time is in twilight stage. Amnesia, periodical loss of memory, not selective memory, generalized memories. Of course, selective too, if the child is having a very severe trauma, he would like to forget as far as possible, as quick as possible. But it is advised amnesia that he is forgetting things. Depersonalization, derealization. Who is he and where he is? 3, we talk about the mental state examination, derealization, depersonalization. It is a bad symptoms that when the person is not realizing that where he is and what he is, derealization, depersonalization, is not aware of it. 2 or more distinct states of consciousness with impaired memory of state-based events. I've already discussed this thing. Next, please. So the fifth domain, which is again very important to be seen and assessed, behavioral control. That was emotional control, thinking control, behavioral control now. Poor, please, slide has gone. Sir, slide. Yes, behavioral control, poor modulation of impulses. In a simple way, there is no control over impulses. When suddenly how he will behave, nobody can make it out. Self-destructive behavior, self-hitting, self-beating, self-destructive behavior. It could be even range from cutting of fingers, cutting of nails, cutting of, chopping of uh, some small insignificant part of it to attempting suicide. Aggression and agitation against others, aggression against others, all the time, free floating aggression, of who is he and what he is being asked and whether it is in his favor or her favor. And sometimes reverse to this, pathological self-soothing behavior. Reverse. Sometimes the person is absolutely free, enjoying his personal life, not nothing to do. Self-soothing behavior, self-erotic behavior, maybe self-erotic sexual activity, and sleep disturbance, eating disorders. These are the issues which comes under behavior problems. Next. Time is short, and I'm told that I have to finish as early as possible. Substance abuse is again childhood. I have seen a child of 7 years having morphine injections, 3, 4 injections a day, 3 injections a day, morphine injections. One morphine injection is sufficient to make a person anesthetic and conduct the surgery. And I've seen a child taking 3 to 4 injections per day, morphine injections, with a very bad history of childhood. Substance abuse, excessive compliance, excessive against, as I told you that Bradley, it was a total disagreement with anything, anybody, total disobedience. And now it is excessive compliance without putting his own understanding what is being asked. जो भी करे, just like if the person is being hypnotized, that whatever person is suggesting, he is doing something like that. Oppositional behavior, reverse to this. Difficulty understanding and complying with rules. He doesn't know what rule is that because nobody bothered rules while behaving with him. So he has no regards for any rules. He has no regard for any norms. He has no regards for any values, social values, norms, moral ethics, nothing like that. Because nobody behaved with him with some ethics. Nobody behaved with him. The government did not behave. The owner of the house did not behave properly while selling the house. Nobody bothered about the fire extinguishers. Nobody bothered about the safety measures, and his entire house was collapsed, where he lost his father and mother. So why should he? There was a rules for construction of house also. It was not observed. So for him, house is the rule has no meaning at all. It is a meaningless word. So the child is not following any rules. He has no meaning. Difficulty. Communication of traumatic past reenactment in day-to-day behavior and play. And not only that, he is simply isolated, he's simply withdrawn, or he's simply aggressive. Even the routine childhood play, he enact as if he's passing through the same event, same traumatic experience. He would play, he would visualize the game. We encourage our children, nowadays the teachers are encouraging, primary school teachers are encouraging to go for visualizing a game, visualizing situation. How far it is good, I do not know. How far we are not encouraging a person to live in the world of fantasy all the time. But the children of that, he have seen the Chota Bheem, so he's playing like a Chota Bheem. He's behaving like a Chota Bheem. He's behaving like a Superman, superstar, and all these things. Whereas I'm not here to discuss issue on this, and and to debate on this. But it is one of the features, then the child having this thing would, in the subsequent periods of time, subsequent days also, he would behave like this only. Next. 6 1 is cognitions. Difficulty in understanding, difficulty in comprehension, difficulty in the learning process. If the child has been traumatized in the beginning, he is all the time preoccupied. Naturally, the attention concentration is poor. He is not able to receive the lesson. He is not being able to reproduce the same way. And difficulty planning and anticipating the situation. His visual accuracy is disturbed. His perceptual accuracy is disturbed. So everything which is required to be a good student, everything which is required to show that his cognitive process is good and intact, it is all impaired. It is all disturbed, if not impaired to the extent that it is organic, causes organic lesions and the impairment, but it is disturbed. Next, sir. Problem understanding, I have already gone through, sir. Learning. Next, please. Self-concept, the seventh and the last but not the least. Domain is self-concept. Lack of continuous, predictable sense of self. Poor self-understanding, self-acceptance, disturbance of body image, low self-esteem, shame and guilt. The last I have mentioned, that shame and guilt. Rest other things can be seen in other condition also. Then when this low body image and all these things, this shame and guilt that, well, कहीं ना कहीं हमने कुछ किया होगा, that is why God is not happy, why God is making me all the time subject of this trauma. Why I have not followed the instruction of my mother, my instruction of my father, why I have gone through, why I went all the time for a party in the late evening. So this shame and guilt, why I have been, I'm the only person, it means that everybody is playing it, enjoying, is living happily. So why I am only victim of this? So this shame, I must have done something, some sin, I am getting the result of this sin. So this shame and guilt is again a part which is chronic trauma may cause. Next, please. Next, sir. Long-term impact of childhood, I've already explained, need not to repeat the same thing. Sir, next. Now come to the million-dollar question. Then how to help it out? You have narrated so many things. Yes, I agree, it happened. So how to help this child? What are prevention procedures? So again, it is a big topic. I'm going to simply, as an interim for my juniors who is sitting over here and practitioners, just I'm going to share some interim thing for next, the detailed long-term, short-term, long-term goals. Again, the intervention always has two goals, immediate goals and long-term goals. I'm going to discuss short-term goals, immediate goals, and maybe sometime if I'll get the opportunity to interact with you, we'll discuss the long-term goals. Otherwise, the time would not be allowed me to. Next, sir. Slide. Yes. Now, as any intervention program, the first thing is that you have to evaluate, you have to assess the situation and the depth of the problem, the severity of problem, and what are the immediate requirement, whether it requires any medical support, any social supports, any legal supports, whatever is things is there. So after having this, when you identify that yes, here is your case, he or she needs you and nobody else, then you have to take up with, and that would be applicable for all the person, even if he needs legal support, even if he needs orthopedic surgeons, or even if he needs anybody, because it is trauma is something which shakes you totally, your psyche, your physique, both. So the first thing which I would suggest is that psychological first aid should always be the first line of action. First line of action, particularly if it is an acute phase, which we usually see the cases of acute phase. Traumatic trauma has become their lifestyle. I'll be discussing this thing. So rarely anybody will come out with the problem that I have been sexually assaulted for so many years, so I need your support. It may be required, your support may be required, because when the person starts showing all the serious problems of psychological nature, cognitive impairment, and all these things, then the person will be handled separately. But if it is an acute situation, so I would go for psychological first aid in 3 category. सर इससे पहले भी कोई स्लाइड? Yes. ABC. A stand for arousal. The person is aroused. Person is shaky, he is in panic conditions. His palpitation, his heartbeat is very, very increased. What we usually do it, हम उसको वहां से दूसरी जहां पर ले आके रखते हैं, जहां भीड़ भाड़ से हटा देते हैं, and we give a fullest possible comfort, physical comfort. हवा आने दीजिए, भीड़ मत लगाइए, ऐसा मत कीजिए, वैसा मत कीजिए, need not to shout, need not to fight, it is not to fight. You see that his arousal, his heartbeat, his blood pressure, his galvanic skin response, GSR, all the parameters which is making a person aroused. You are all the professor and senior teachers of psychology, you know what is arousability is. So you have to control his arousability, so that unless the person is emotionally aroused, he is not controlled, the logic would never come. When the emotion arises, intelligence paralyzes. So no matter how much you think you would explain, whatever suggestions, whatever counseling guidance you will give, it will not be understood. So you have to make the person arousability, you have to reduce the settle down, his diminish his arousability. And the B stand for facilitating his functional behavior. He is now confined to his room. He is not coming out of the fear that the road is with full of traffic. The next day I'll come out, I will be crashed once again. I cannot go out. I cannot meet any gentleman. I could not go to the school. The child is so much scared. He is functionally not working. He is functionally impaired. So the second thing is that after arousal, you have to take care of his to make him functional once again. And whatever techniques it is, since it is behavior, naturally it would require behavior modification. Naturally it would require reinforcement. Naturally it would require environmental manipulation. It would require reassurance. Whatever psychotherapeutic support, whether it is supportive psychotherapy, whether it is behavior modification, when you have to reinforce a positive response, deficient behaviors is minimizing the excess behavior is reducing, all those formulas, but it has to be taken care of, because unless the child you make him start functioning once again, unless the child is coming to school, controlling his fear of being bullied once again in the school, fear of being assaulted once again in the road, he will not come out. So your entire purpose, she would remain be traumatic, even no matter how much support you give it. And the third is support to clear cognitions, his thinking process. And now I will be discussing the slide slightly more. Sir, next slide. Arousal, I have already decreased the excitement. Behavioral assist recouping his effectiveness, his effective behavior accommodations, his start his intellect should start functioning, and probably his reasoning, his personal logics, his personal decisions, his social decisions, his personal concepts should be improved. Next. Next, please. Already done it. Already done it. Next, sir. Done it. Next, sir. Expected outcome. What way you are going to expect outcome? As the time goes, and the more resources will keep on coming, more resources. The time, you know, the time is the best healer. And the person starts adjusting, adapting with the new situations. The overall presentation of a traumatic child is likely to be improved, and his coping mechanism, coping style would increase, coping capacity will increase, and a stress sign will diminish. I've seen in Srinagar, I've seen in many other places that always for 5 days, immediately after any mishappening, had been very, very painful. But again, dunya mamool pa jati, life has to go on. Life has to go on. Your role is that life has to go on without minimum, with minimum possible adjustment process and intact social well-being, intact human values, and intact interpersonal relations. With this, I think I've finished my thing. Thank you very much.
Hello, sir. Good
evening, Vishmata. How are you?
There has been, I think, some connectivity issue. I am so sorry. Yeah, I'm good, sir. I'm good, sir.
Yes.
There has been some connectivity issues. I think that's why I'm being a little slow. So, hello, our viewers. So this is the question and answer session. Hello, am I audible?
Yes, yes, you are.
Yeah, okay. All right, sir. So there is one question which has been asked by Rakesh Srivastav, sir, and he's asking that is psychological trauma permanent?
No, definitely not, because I told you that in trauma, the emotion is the foremost and the biggest component, and emotional condition is not a permanent condition. It is definitely not, and the recovery is always good. Even in the prediction of prognosis in our day-to-day clinical practice, we evaluate the prognosis of any problem on the basis of how emotionally he is intact, affect is intact. Affect makes a person lively, and emotion keeps on changing. So it is not that psychological trauma is a permanent. As I told you that as the time will pass, ये वक्त भी गुजर जाएगा, and the person will recover. To what extent he will recover, that depends upon how healthy environment, how supporting environment, and how professional support the a person is getting. But definitely it is not a permanent. Some scars would always be there. Some precautions would always be there. The person will continue taking precautions. Like mask is going to be the lifestyle for another couple of years, I would suggest. Should be. I'm not very pessimistic, but it should be realistic. So it's same way that maybe some fear, some scaring feeling would be there, some mistrust would be there, but definitely not the person would remain the same even after 5 years, 6 years, 7 years, provided the traumatic child is getting good support, resources, and he is saved from multiple trauma. As I told you that multiple trauma, one after another, one after another, one after another. And there are stories. Even the COVID condition, the person has attempted rape condition. Patient has gone for checkup of his family members, and in the hospital itself, the person has been misbehaved. So these traumatic conditions and the multiple trauma. If it is not there, I am positive that with the good support, the person's severity of traumatic condition would reduce, diminished. And again, it is always an individual differences of coping and resilience. It all depends upon how strongly immune you are. Psychological immunity is the resilience. We talk about a lot about immunity, but in psychology, our resilience is our psychological immunity, coping mechanism, adaptability, so all these things. Yes, please.
Definitely, sir. And one thing that you said is very correct कि ये वक्त भी गुजर जाएगा. And this is something very important, not only in the time of COVID, it is also important in any psychological trauma that is being faced. So there is one more question basically from my side, and that is that, sir, how for that particular moment, when that time is there in the front of the patient and he is suffering from acute trauma, how can, for that time being, we can console that particular person?
Well, again, depending upon the individual requirement, if the person is bleeding very profusely, your consoling is not going to help anyway. You have to go and rush and to see that the blood is stopped and the blood is required, it is transfused. So that starts from that, and the mother is never tied in consoling the child. That depends that to whom you are consoling and to whom you are being consoled. So no mother is ever tied to console the child. Whenever he weeps, whenever he is in this crisis, whenever he is in stress, the mother is always there to console, and it works. So again, depending upon that in which circumstance, in which situations you are passing through. But of course, again, I cannot give you one-to-one answer, depending upon the individual situation, and this is my answer.
Of course. Thank you so much, sir. Due to limitations of time, we won't be taking much questions today. So over to our president, sir, Anand sir, to please address our speaker of the evening. Sir.
Okay, Bismita, thanks. And thank you, Dr. Zaidi. It was a wonderful speech and very informative. You have very well explained about the trauma and its impact on various aspects of children and also the gender differences, and very well explained the 7 domains of impairment in children exposed to complex trauma, especially attachment, social isolation, interpersonal difficulties, difficulty accommodation, physiological changes, increased medical problems, somatization, difficulty in affect regulation, dissociation, aggression, agitation, self-destructive behavior, sleep disturbances, eating disorders, substance abuse, difficulty in various cognitions, low self-esteem, shame and guilt, a lot of difficulties you have explained in 7 domains. It was really very, very informative, and you also explained how to help and focus of interventions or psychological first aid, how to provide social support and intervention in the condition of such traumatic situations. So it was really very informative and very wonderful session, and we are really blessed that we had such a great knowledge with you. Thanks.
Thank you very much, sir. Thank you.
All right, so thank you. First of all, I would like to thank our speaker of the evening, Zaidi sir, and thank you so much, sir, for giving time to us today. And obviously your concepts and your presentations about the trauma were really helpful and really very, very informative. I would also like to thank our President, Sir, Professor Anand Kumar, Sir, who has been the mastermind behind all these webinars and all these guest lectures which we get to you. Also, I would like to thank our chairperson of AIBAS, Dr. Rakesh Jain, Sir, who has always day and to bring these sessions regularly to you. Guys, our viewers, your with us is all we want, and that keeps us going. So guys, keep commenting us, and sir, let me just inform you that we have viewers from all over India, and so we have got all the appreciations and all the comments regarding this session, and we will really look forward to have more sessions with you in our further live YouTube channels. So guys, please do subscribe to our channel so that you get all the timely updates and all the updates regarding clinical health psychology, as well as any other branches and any other information regarding psychology. Also, I request all of you to please visit our website www.iahp.net.in so that you can get all timely alerts and you can know that what our academy is doing and what all we are planning for all of you. So thank you all our viewers, and thank you everyone who is present today, especially the speaker of our evening. And thank you everyone, and God bless.
Thank you very much. Thank you very much.